In today's Healthy You, we're talking about teeth and the importance of paying attention to oral health. It is important for all of us, but especially young children. 13 on your side, health reporter Elena Holland is here now to explain why. Elena.
Well, Julia, cavities or tooth decay is the most common chronic disease for kids. That's according to the CDC. They can cause pain, infections, and even problems eating, speaking, and learning. The CDC says 1 in 5 children ages 2 to 5 years old has at least one cavity. For many, it comes down to what your kid eats. We reached out to the University of Michigan School of Dentistry for some suggestions. Now, first, they told us to avoid snacks and drinks with processed sugar, offer fruits and vegetables instead. They don't stick to the teeth as easily. Brush your child's teeth twice daily. That's the same as what's recommended for adults. And if you have a baby, use a washcloth to wipe their gums after each meal to remove food, residue, and if they fall asleep, you can do it when they wake up. And finally, don't forget to floss.
I know in a younger age, you will feel like it doesn't make sense to me. Their teeth are not even touching. But the younger you start, it establishes that habit. So we're more talking about like getting them transition to the habit in the future. So even though you're just flossing 1 or 2 teeth when they're very young, it will still build a very good foundation for them in the future.
Dr. Tai says it's also important to use fluoridated toothpaste even when the first teeth come in. She says just a swipe on the brush is enough to do the trick and will not harm the child if they swallow just a small amount.
Elena, there have been concerns in recent years about fluoride. What have you learned?
Yeah, the American Dental Association says fluoride is naturally occurring and there's no health risk when it's added to the water supply. It has been proven to reduce tooth decay in children and adults by 25%. Now, the ADA says adding fluoride to water is like fortifying milk with vitamin D, orange juice with calcium, and cereals with vitamin B and folic acid.
Thank you, Elena. And in 1945, Grand Rapids became the first city in the world to fluoridate its drinking water.